Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, the Transportation Department implements a reduced physical distancing policy today in public transport in its bid to accommodate more commuters and boost the economy. But health experts and transport groups are raising concerns on this new policy, saying that easing social distancing rules can trigger the surge of COVID-19 cases. Philippine College of Physicians President Dr. Mario Panaligan and Transportation Undersecretary Artemio Tuazon join us live. After 6 months of strict social distancing amid the coronavirus pandemic, authorities are scaling back as it attempts to reopen the economy. Today, the 1-meter distancing in public transport vehicle is eased. Transport officials assure the public this has been approved by the team of government officials tasked to fight the pandemic. But are the potential economic gains of this measure worth the risk it poses to public health? Let's go straight to the source of the story. We have Philippine College of Physicians President Dr. Mario Panaligan. Dr. Panaligan, welcome to the source and thank you so much for your time.
Yeah, good morning and thank you for this opportunity, of course.
Dr. Panaligan, are you personally concerned or worried about this reduced physical distancing in public transportation that will be implemented today?
Yes, we are worried and concerned. Primarily, this can, of course, increase the chances of transmitting and acquiring the disease, particularly because of the nearness of the distance. And just remember that this infection is droplet-based, and therefore there's a minimum distance required for us to avoid any form of transmission.
Doktor, malaki ho ba yung diferensya ng 1 meter sa 0.75 meters?
Actually, malaki yun, no? Kasi magkakadikit yan eh. In fact, yung 1 meter distance, meron pa rin chance, no? Na magkaroon ng acquisition, around 13% chance that there will still be acquisition. And just remember, when a person coughs or sneezes, definitely mas malaking chance na lalagpas sa 1 meter yung possibility na makatransmit ng sakit.
But they are wearing masks and shields. Doesn't that not help? Magkakaroon ho ba ng transmission in an area kahit po naka-mask at naka-shield po yung individual?
Actually, meron pa rin chances kasi marami sa atin hindi pa rin masyadong sanay o marunong magsuot ng mask. In fact, marami pa rin nakikita na naglalakad na nasa baba yung mask. And of course, kahit na may face shield dyan, just have to remember, yung face shield is not actually 100% protective kasi bukas dito sa taas eh. Of course, it's not easy to wear it aside from, of course, the nagiging blurred yung vision natin when we use the face shield. And certainly, we also forget, of course, avoiding touching our faces, and definitely that can also facilitate the transfer of this organism to others. No? And that's precisely the reason why it's quite difficult really to maintain, of course, that particular problem or resolve that problem of transmission if we will, again, ease up the distance and make it less than 1 meter.
What kind of effect do you see will be the result of this reduced physical distancing? Do you actually think, Dr. Panaligan, na tataas ho yung kaso ng mga COVID-19 infections sa bansa because of this new guideline or this new order by government?
There is really a chance for the number to increase further. Just remember that's still high up to now. We have not yet really controlled the virus. In fact, we still can see in the NCR more than 1,000 per day. And therefore, that number can further increase, no, by of course decreasing the distance. When we actually talk of the distance, there's a higher chance of getting the disease if you lessen, of course, the distance between the two people or between the two persons, primarily because of the risk of transmission.
Mhm. And it's not just this, because after 2 weeks, ito pong 0.75, this will be further reduced to zero point 0.5. Ibig sabihin, Dr. Panaligan, kung ano po yung kinasanayan na distansya after 2 weeks on September 28, ano po, yung distansyang yun, kalahati na lang dun sa nakasanayan.
Yeah, and after 4 weeks, it will become zero point 0.3. And just remember, yung ating mga transport vehicles, limited yung airflow din dyan eh. Yung ventilation per se is very poor. Lalo-lalo na pag umuulan, syempre naka-enclose yung mga yan. Therefore, there's a higher chance or higher risk of getting the disease. At yun ang pinaka-problema eh. Pagka magkakadikit na tayo, kaya sabihin na naka-mask, kaya sabihin na naka-face shield, nandun pa rin yung chance that you can actually transfer your condition or your infection to other people.
So how would you describe this move by government to reduce physical distancing?
They said that, of course, this will further improve, of course, workforce because there will be more people who can go back to work. But our worries, of course, if these people actually get sick, then there will be, of course, less people that's going to be working because they need to isolate themselves. And in fact, they can be hospitalized later on if they develop severe disease. And therefore, yung worry namin, baka mas lalo mabawasan yung magtatrabaho, nandoon. No? So, yung cycle, sabihin na natin, nandoon. Ang problema, if we again ease up that distancing, mas malaking chance that this will spread further. I was thinking that
Mhm.
probably we can actually increase the number of PUVs, so public utility vehicles, so that we can help the workforce and provide them with additional vehicles for them to go to their work. But of course, yung traffic naman ang magiging problema, the longer we stay within the vehicle, the higher the risk din. No? And therefore, we also
Opo.
need to, of course, address that problem with traffic. And aside from, of course, providing more vehicles to our workforce.
So how would you siguro describe the timing of this? Because as you mentioned, mataas pa po, Doc, yung ating mga kaso. Yesterday, nandun po tayo over 3,000. And of course, the health department has also described this na yung iba ho kasi mga labs late din po nagbibigay ng resulta. But what about the timing of this? Look at it, 261,000, 3,000 yesterday. I believe it was 4 or 5,000 even the day before. Mali ho kaya yung timing nito?
Yeah, medyo mabilis eh. Lalo na ngayon, nag-uulan-ulan pa, no? And therefore, our worry might actually be true or may become true later on. Kasi hindi pa talaga natin nakokontrol yung number up to now. At habang dumadami may sakit, no, sabihin na natin, limited na nga yung quarantine facility, sabihin natin nagdadagdag sila. But the thing is, there's still lots of individuals who get sick and therefore there's lots of opportunities for this virus to spread to others.
But you know, the DOTr had mentioned that they also sought the advice of medical experts. Was your group asked about this, the Philippine College of Physicians?
Uh, I'm not sure who they talked to because, of course, when we were consulted, it was somehow late because when we sent the letter, it was already Friday afternoon, addressing, of course, the
Mm-hmm.
concern so that they will know about our worries. And we actually base on our assumptions on the scientific evidence that they have viewed abroad. There's a good study about the transmission of the virus in train passengers. And of course, if you are sitting beside each other in the train, definitely the risk could be more than twice or more than 2 to 3 times higher than if you actually sit apart, 2 rows apart and certainly that problem will not be resolved by actually decreasing the distance among each other.
Mm-hmm. Because it's going to be implemented today, Dr. Panaligan, what can you recommend to the riding public?
Thank you, Pinky, for that. Certainly, if possible, you still maintain the adequate distance among yourselves, among each other, primarily because even if you wear the mask, the face shield, you still need to avoid, of course, somebody whom you know or you suspect has a respiratory tract infection. That's because he just coughed. Definitely, you need to avoid getting near that patient or that individual. In fact, I would advise those
Mm-hmm.
individuals who are sick not to report to work And then second, make sure that you bring your alcohol so that you can actually wipe your hands, do hand hygiene every now and then, especially if you're handling many areas or those frequently handled no, areas, so that you can avoid anything that can be acquired no, through contact. No? So it's not only the COVID infection that you can avoid, but also the other infections that are transmitted by droplet as well as contact.
We'll see what happens, Dr. Panaligan, because as we mentioned a while ago, on September 28th, this will be further reduced to zero point 0.5, and then thereafter, 2 weeks again later, it's 0.3. Let's see what government will do and how will this actually affect infections in the next couple of weeks. In the meantime, Dr. Mario Panaligan, sir, thank you so much for your time.
Maraming salamat din po. Thank you.
And coming up, we'll speak to Transportation Undersecretary Artemio Tuazon to find out more about the safeguards in easing distancing in public transport. You're watching The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. Our guest today, Transportation Undersecretary Artemio Tuazon. Yusek Tuazon, welcome to The Source, and also thank you for your time.
Good morning, ma'am. Thank you for having us here.
Yusek, you earlier said that you guys actually consulted medical experts regarding this reduced physical distancing. What I want to first find out is who these medical experts are that you consulted.
Yes, ma'am. Actually, ma'am, during our IATF meetings before, there were several medical experts led by Dr. Tony Dance who presented data to us regarding the transmission probabilities when using face masks, face shields, distancing, the disinfecting, the hand washing, and everything. That was part of the basis of our decision and our recommendation to the IATF to reduce the physical distancing between the passengers inside public transport. In addition to that, we also referred to the studies of the International Union of Railways, who did the same studies on physical distancing and determined that the 1 meter distancing is not really necessary for us to be able to operate the rail systems.
Are you talking about USEC, the survey of international practice?
Yes, the international practices as published by the International Union of Railways.
Right. I am looking at this, and it cites countries such as the Philippines included, China, Hong Kong. You even have Indonesia, Japan, Malaysia, Singapore, South Korea, Taiwan, and Vietnam. Would this, I guess my question is, would this be a good study considering that most of these countries do not have the kind of cases the Philippines has? In fact, if you look at this, it would probably be the Philippines, if I'm not mistaken, with the highest number of COVID-19 cases. And then the next would be Indonesia.
Yes, ma'am. Actually, that would be true. But if you will look at the study was done even prior to these countries having flattened their curve or reduced their COVID numbers. The study was done when some of them were still also in the peak of their COVID situation. And part of the reason for this is that they don't think that distance by itself will actually defeat the transmission of the virus. There are other protocols in place like the face mask, the face shield, the hand washing, the temperature checking, and the disinfecting of the public transport that actually help to prevent the transmission.
Right. But when I spoke to Dr. Mario Panaligan a while ago, USEC, ang sabi ho niya in very simple terms is that at the end of the day, these are droplets. And common sense dictates the closer you are, the possibility of infection will be higher kesa mas malayo po yung mga commuters. What do you say to that?
Well, actually, ma'am, if you look at the World Health Organization study, it dictates for a 1 meter distance between passengers at least. But the study
Opo.
does not take into account the implementation of the face mask, the face shield protocols, the disinfectation. It was on a normal transmission basis, which was 1 meter is the
Mm-mm.
distance that they determined. And I think it would be also noteworthy to understand that the study was done way back in 1980, when we didn't have this COVID pandemic yet.
Mm-hmm.
So we really believe that with the health protocols such as the face mask, the face shield, the no talking policy, no cell phone calls within the
Right.
public transport, then the issue of droplets will be greatly totally reduced.
Mm-mm. Which I understand what you're saying, Yusek. But if you're saying this study was in the 1980s, the WHO continues to recommend a 1 meter distance. Is that not true?
Yes, that's right. But it's the 1 meter distance if there are no other protocols in place. But like I said,
Mm-hmm.
we're implementing the no face mask, no face shield. It's really meant to minimize the droplets which results in the transmission of the virus.
So, Yusek, when this was presented, my understanding was this was presented to the IATF, which obviously the DOH co-chairs. Ano po, was there any concern? Did they raise any alarm on this reduced physical distancing? Nagsabi ho ba sila na sandali lang baka hindi pa to panahon or it might be ill-timed?
Was approved, we did not really hear any objections from the representatives of the DOH who were present then. Actually, this was even also supported and recommended by the Economic Development Council, and that's the
Mm-mm.
reason why also some secretaries supported it, and that's why it was approved by the IATF.
So during that meeting, when the DOH was there, can you tell us who was there when this was presented to them?
I am not really well. I'm sorry, I cannot recall who was physically present at the meeting, but I'm sure that there were DOH representatives at that meeting.
And they did not raise any concern on this.
No concern was raised.
Mm-mm. What about the Metro Manila mayors? Because I heard Mayor Olivares a while ago, he told CNN Philippines that they were not consulted either. Is that true, sir?
Ma'am, the DILG is part of the IATF, and it is the mandate of the DILG to talk to these mayors. And they were likewise present during the meeting when the protocol was approved and the resolution was issued.
Okay, so nandun po yung kanilang representative is what you're saying.
Yes, yes, ma'am.
Okay.
If I remember right, also Governor Dax was also present in that meeting, who represented the Local Governments Association of the Philippines.
Mm-mm. And also no concern there.
Also none. He said, I think if I
You
remember
said,
right, what he said was that they will wait for the guidelines issued by the DOTr, the DTI, and the DOLE, and they will follow.
okay. And the guidelines really came out when?
Our guidelines came out last week for implementation starting today.
When last week, Yusek?
If I remember right,
The
that
complete
was, I think,
guidelines, Yusek.
maybe I think around Wednesday last week.
Or Thursday, yeah. Oh, all right. So, I guess what you're trying to, from my understanding, you presented this because definitely there is a problem with the transport sector, with the commuters trying to find
Mhm.
rides. Nahihirapan po sila mag-commute. This is a solution to the commuters' problems. Ano po. But would this be, yung correlation ho kaya nito, Yusek, dun sa matutulungan yung mga commuters compared to the possible Yusek, a problem of infections because of this reduced physical distancing, would this be worth it?
Ma'am, if I can be allowed to put lang in proper perspective the reduction of the physical distancing from 1 meter to 0.75. Actually, if we really look at it, for public utility vehicles like jeeps and modernized jeeps, this only translates to about 1 to 3 additional passengers for them. For buses, what would be added would only be the standing in the middle for them. So there's not really much of a. It will not be the case wherein the buses or the jeeps will be overcrowded and with everybody will be packed
Yeah,
in. That's not the case. We will still maintain the
right.
distancing. We merely reduced it.
I understand. Yusek, in fact, that was my question to Dr. Mario Panaligan. Tinanong ko po siya, malaki ho ba yung diferensya ng 1 meter at 0.75? And he did say yes, because if we siguro, pag-isipin po natin to in feet, no? 1 meter is about 3.3 feet, if I'm not mistaken, and 0.75, yung ngayon po, that will be about 2.4. That's why I asked him, and he did say that this is a big difference.
Actually, if we talk about it in inches and or centimeters, it might look big. The 0.25 difference might be big. But in terms of actual number of passengers, you're really looking at only one
Mm-mm.
or two passengers that will be added into the public transport.
Yeah. Jeeps is like one, ang dagdag ho ata sa mga jeep is between 2 to 3, ano po? Sorry sir, medyo nawala
Mga
ho
one
kayo
and two,
kanina. I missed that part.
more likely like one and two, ma'am. 1 to 2 people lang po.
All right.
Madadagdag.
But you said if we go further, on September 28, this 0.75 will be reduced to 0.5. Is this set in stone, Yusek, or is this something that pag-aaralan nyo muna in the next 2 weeks while this is implemented? Or sigurado na nga ho ba na on September 28, it will be reduced further to 0.5?
Actually, ma'am, the directive of Secretary Tugade was first for us to study. If you really think about it, the mandate given to us by the IATF was 0.5 meters distance between passengers. But actually, Secretary Togade thought it would be prudent and better if we implement it gradually and in phases. So from the 0.75 starting today, in the span of 2 weeks, we will be studying it. If there are any problems that we encounter during the 2-week period, we will revert back to 1 meter. Now, if there are no
All
problems,
right.
then we reduce to 0.5. Then for another 2 weeks, we study it. Again, if there are no problems, then maybe we can reduce it to 0.3. So it will be something that will be
It's a work
closely monitored, studied, and enforced.
It's a work in progress. We'll be taking a short break. This is The Source on CNN Philippines. We'll be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, Transportation Undersecretary Artemio Tuazon. Yusek, again, if we look at the numbers right now, we are at 261 cases in the country. Yesterday, there was an increase of 3,000. Because of this reduced physical distancing, would you say this was the proper time to implement this? Yusek Batan, can you hear me? Yusek Tuazon, sorry.
Uh, I'm sorry, can you please repeat? The signal got bad, I think. If you can repeat the
Yeah,
question,
sorry
please.
about that also. Yusek Tuazon, my question was this, kasi ang tinitingnan po nating mga kaso ngayon is 261,000. There were 3,000 infections recorded yesterday. Would this be the appropriate time to actually implement this reduced physical distancing?
Well,
We're having problems with our communication with DOTr Undersecretary Artemio Tuazon. We're gonna try to get him back on the line. But right now, of course, what we're talking about is the reduced physical distancing that will be implemented today. This is coming from, of course, the DOTr. Some medical experts are questioning this. And even with the report of our correspondent a while ago, si Pauline Versosa, sabi niya may ilan daw mga commuters who are a little bit concerned about this. But of course, this is the plan of the DOTr to be able to help the public para po makasakay dahil nahihirapan nga po dahil sa konti lamang yung mga public transport available ngayon. However, just also to add to this, the DOTr implemented or allowed 1,100 more jeeps to ply routes beginning today. So this should in one way or another, help the commuting public. Unfortunately, we cannot get USEC Artemio Tuazon back on the line. So just to summarize that interview, he was basically saying, obviously, this is implemented today, but it's almost like a work in progress. They did consult medical experts regarding this. The safeguards are in place, such as face masks, face shields, temperatures, no talking on the phone when you are commuting as well. And they will review this every 2 weeks, because after today, 2 weeks thereafter, on September 28th, the plan is to reduce this 0.75-meter distance to 0.5 meters. So in the meantime, we're just going to have to thank Transportation Undersecretary Artemio Tuazon. Thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.